Thank you for joining us for a Fox 40 News special report. I'm Jason Weinstein. In this next half hour, we will take a close look at the deadly heroin crisis in our area, why the problem is so complicated, and what you can do if you or someone you know needs help. Right now, Fox 40's Molly Darrow has the story of a deposit athlete's battle with addiction.
I started taking heroin, and it came to the point where I was snorting 2 bundles at a time.
Shane Smith, former college football star, says addiction nearly took him out of the game of life.
You'll do anything for it. You know, stealing, lying, cheating.
His taste for heroin started with pain meds prescribed for a football injury.
You know, my shoulder would hurt. I would just pop a couple pills, go back, do it again. Come to the point where I was getting stuff off the street.
This started at the University of Central Florida. He left school early knowing something was wrong. Smith got a second chance at Wagner College, but was injured once again.
I know one thing to take care of that.
Percocets led to Vicodin and stronger pills. Then he found heroin.
You know, you feel like you're on the top of the world.
And he couldn't get enough.
So that's what I went to intravenous. And that's when I fell in love with it.
With love came deception.
You know, I was great at hiding things, you know.
His tight-knit family was losing the Shane they knew.
Spoons were missing, and that was an indicator if something was up.
They had no idea what was going on. By this time, Shane was not only a full-blown addict, he was also a dealer.
I've had young kids come up and knock on my door before and asking for things, you know, my nephew and my niece's age. You go from a Division I athlete and, you know, having all thousands and hundreds of thousands of eyes on you, and you don't want to talk about something that's stuck in your closet.
Everything came out October 1st, 2013, a day the Smith family will never forget.
I kept rubbing his chest and telling him, "Don't go, it's too soon."
His brother-in-law, Pat, gave him CPR.
It was something I would never want to go through again, but I mean, if it came down to it, I would do it, be the first one there to do it again.
Helping to save his life and starting Shane's path to recovery, but not without bumps along the way.
It's probably the hardest thing I've had to do, but the most rewarding thing to be able to come out of.
Through it all, the Smiths never left his side.
All right, lumberjacks on 3, lumberjacks on 3.
2 years clean, Shane coaches youth football for Deposit, teaching players as many lessons about life as he does about the game.
Just hopefully the people that do look up to me, they don't fall in the same footsteps that I did. So, and that's why I share my story now.
So that's the story of Shane Smith, joined right now by Carol Kuklis from the Addiction Center of Broome County. And Carol, Shane's story included a 7-year period where he was using prescription medication. And based on your experience of the addicts who come through the doors where you work, how common is that?
That's quite typical. People don't generally start out with heroin. They start out with either prescription medications. Sometimes it's prescribed by them, sometimes they're getting it from other sources, or they're starting out with other kinds of gateway drugs such as alcohol or marijuana.
To what do you attribute the growth in the sheer number of heroin cases that you're dealing with?
Primarily due to prescribed medication, prescribed opiates, easy access, and that's what eventually leads to the heroin.
So what services does the Addiction Center of Broome County provide, and overall in the community, what level of treatment is there?
Okay, at our agency, we provide substance abuse outpatient treatment, which means that the patients are coming in. Some come through 5 days a week, some come through fewer times a week, but anywhere from 5 days, which is our outpatient rehab, to intensive outpatient, which can be 3 to 4 times a week, to aftercare, relapse prevention, which occurred generally twice a week.
All right, well, Carol Kuklis from the Addiction Center of Broome County, thank you for providing us some context to some of these issues. And when we return, stories of heartache and helplessness from parents of addicts, and what to watch for if you think someone close to you is using heroin. Welcome back to this special report. The people who best understand the devastation caused by heroin addiction are families of users. Their lives are forever changed. It's the shocking discovery any parent fears making.
They said he had burglarized houses, and I didn't understand and couldn't believe it because he had closed the restaurant he worked at that night, so it didn't really make sense to me. And when I met with the public defender, he said, well, a lot of things that heroin addicts do don't make sense. And that was my announcement that my son was a heroin addict.
His brother told me. He has two older brothers, and one of them said, Mom, you know, don't you see what's happening? And I said, what? And he says, well, let me tell you. And he brought me, you know, a burnt spoon and some little bits of cotton. And he says, do you know what these things are? And I said, no. Well, and he explained that when I was away at work, Sean was shooting up heroin in my house.
I actually found a syringe in the dryer that had fallen out of his pocket, and I forced him to roll up his arms and the sleeves of his shirt, and there were tracks on his arms.
While these women found out about their child's addiction in different ways, they shared the common experience of having heroin tear their families apart.
The loss of trust and the heartache. It's terrible to see what this has done to my son. His brothers love him, but the trust is shot.
There were many times that people counseled us to kick Johnny out of the house. I know that we knew we couldn't live with that.
Locks on bedroom doors, locks on the house, changed locks, you know, controlling when he has access to his own home.
He would say, I'm a scumbag, and we would say, no, you're not a scumbag. Your addiction is a scummy disease, and it makes you do things that you would never normally do, but you are not a scumbag. You are our beloved child. And that's hard to say when someone is wreaking havoc in your home, stealing from you, lying all the time.
All three mothers rode the roller coaster of rehab and relapse. Swartz's son, Sean, is currently in long-term rehab to try to break a 10-year addiction. Plus lost her oldest son, Jeff, to a 10-year addiction in August of 2014. Penny Stringfield lost her 24-year-old son, Johnny, in February.
When Johnny was well, or when he was trying to get well and he was honest, he would say, my full-time job is to get my fix and to make sure that no one around me really knows what's going on.
Plus has founded Truth Farm, a group dedicated to changing policy and erasing the stigma of heroin addiction. It's also created a tragic kinship.
We keep discovering each other. I'll say Alexis, who founded Truth Farm, we've been friends for years. I did not know her son struggled with this. She did not know my son struggled with this.
That it's becoming more of a conversation. Families feel safer to talk about it and feel safer to come forward and say, yes, my family member needs help. We're having a hard time getting it.
She got the call that I've dreaded getting. We want our sons to live and thrive, but until we have a way to battle the heroin epidemic effectively, we're going to lose our loved ones.
In Broome County, Jason Weinstein, Fox 40 HD News. Well, we just heard from a number of parents who've had to deal with addiction in their families, joined right now by State Police Captain Patrick Gary. And Captain, you had 18 years in narcotics, and now I know you deal with a lot of parents who go through these similar addiction issues. What is your message to those parents?
I try to make sure that parents understand, first of all, that they're not alone in this, that getting word out to family and friends is actually an important part of dealing with this issue. And most importantly, I like them to know and want them to know that they need to be extremely involved in their kids' lives, including anything they're doing on social media, who their friends are, who they're dealing with, what their passwords are on social media, Twitter, any of them. If they don't know how to use them, they should educate themselves on how to use them and really get rid of the notion that your kids need privacy. Privacy and being naive to these issues is really the number one thing that is going to let them continue on a path that'll lead to addiction.
For those parents who haven't had to either yet deal with it or hopefully never have to deal with it, but who come to you and speak at these forums, what are maybe some of the misconceptions, some of the things that they need to learn in order to best keep their kids away from this kind of addiction?
Well, the biggest misconception I think that people have is that they believe that this drug only hits certain classes of people, and that's just not true. We see it in all classes of society and all ages. So kids at any level are at risk, and many times kids are using pills and things like that that they don't realize can lead them down the road to addiction, and that's one of the biggest misconceptions out there, is that to become addicted to heroin, you have to just start right out with heroin. In all of our dealings with people who have been arrested or involved in heroin at any level, whether they're users or family members, we find that many times alcohol and then marijuana lead into the use of other drugs, and then the other and probably biggest issue that we're dealing with at this point are prescription medications that either are sitting in a parent's medicine cabinet at home, or kids steal from somewhere, or they have a prescription that's left over from a surgery, and then they experiment with that for some fun.
As the demand for heroin has grown so much over the recent years, obviously the supply has had to adjust. How has the supply grown as well?
We are seeing in the New York State Police really unprecedented levels of heroin enforcement all across the state. And it's not just a Binghamton issue, it is a statewide issue, and it's a nationwide issue.
Well, it's a changing world, certainly, and as this epidemic has grown, a lot of the issues involved has grown as well. Thank you for stopping by here tonight, and hopefully some of the parents out there can take some of that information and put it to best use. Captain, thank you.
You're welcome. Thank you.
All of the people you have heard from decided to speak out to help others. Many families and addicts remain silent. When we return, we will look at the stigma that still surrounds heroin addiction. The heroin epidemic is fueling a growing body of research on the addiction and the powerful hold the substance has on the brain. Joining me now is Lynn Skinner, who's a registered nurse and health coordinator at the Addiction Center of Broome County. And Lynn, you deal with the medical aspect of people who are looking to rehab from their heroin addiction.
I do, yes.
And so what are some of the things that you do when somebody comes in?
Well, the first thing we do is an assessment to find out if they are in withdrawal, if they need further treatment, and if they've already been through withdrawal, if they're having cravings and urges, then we can offer them Vivitrol, which is kind of a newer medication to this area. It's a monthly injection, and it reduces urges and cravings for alcohol and opiates, and also forms a blockade. So if someone were to use while on this medication, they would not feel the euphoric effects, but they may still have the physical effects.
Now that sounds like a magic bullet, if you will, but somebody has to be there in their rehab process, mentally, physically, what have you. It's not just a matter of kind of snapping your fingers, right?
Right. Vivitrol only works in conjunction when there are group therapy, individual therapies. What it does is it kind of tricks the brain into thinking it doesn't need drugs or alcohol, so the person can, instead of focusing on how sick they are and having thoughts of using all the time, they can now focus on recovery. And what that entails is anywhere from learning coping skills to using logical thinking and decision making, and things that maybe some people never even thought about before, like art skills and how to enjoy their lives.
Vivitrol seems like a promising treatment, but really any treatment, at least in your mind, seems to start with treating addiction as a disease, correct?
Correct, yes.
How does the disease manifest itself in the brain?
Any disease has a set of symptoms and will always lead to death if gone untreated. And it's no different than having something like cancer or diabetes, where there are relapses, and relapses have to be treated right away or they get out of hand.
Treating it as a disease could take some of the power and the stigma away from heroin addiction.
Correct, yes. Oh, you know, many times our patients are suffering, they're beating themselves up so bad. And I ask them, you know, if you had cancer, would you do that? It's no different. If you had diabetes and you had a wound infection, need to go to the hospital and get it fixed, would you feel so bad about yourself? And they all say no. Well, then this is no different, and you need help. And it's possible to stay abstinent. And the goal is for long-term remission, high quality of life remission. And relapses will happen, so we need to teach people how to deal with them correctly. Otherwise, they go all the way down the ladder and lose everything they own, sometimes lose their lives, and it's so devastating for families and communities and everybody.
Well, that long-term remission, hopefully lifelong remission, is certainly what we're hoping for. Lynn, thank you very much for joining us.
You're welcome. Thank you.
Up next on Heroin, a community in crisis, a look at the lobbying efforts to help fight the epidemic. Binghamton is like so many communities across the country, calling on their state and federal leaders for more funding, more treatment facilities, and resources. A small coalition from Binghamton joined tens of thousands outside the National Mall in Washington, D.C. for an historic rally in October. About 35,000 people wanted to bring national attention to the heroin problem. Moms and dads with pictures of the children they lost to heroin called on Washington for funding to address the stigma surrounding heroin addiction. I'm joined by Alexis Plus, who's a co-founder of Truth Farm, which is an organization committed to lobbying for change, try to affect some positive change when it comes to facing the heroin epidemic. And Alexis, we've heard so much from people tonight and really throughout the recent time when we've been talking about this epidemic, about really what's wrong, how large it's got, and how big of a problem it is. But how about some hope, some of the efforts that you've tried to put together to improve the approach of attacking this problem?
Well, I'd like to start with talking about the fact that the more we talk about it, which we appreciate the news and media coverage that we've had, the less the stigma is. So we've had a lot of families come forward and introduce themselves to Truth Farm and say that they didn't know where to turn. They felt very alone, and I think encouraging the conversation and talking about it more and more, letting people know that they're not alone, this can affect any family, is a huge part to reducing the stigma and then encouraging treatment.
And so you have some specific lobbying efforts, though.
Sure. A lot of the things that we're trying to work towards make treatment more accessible to families. There's a great misconception that if someone's loved one suddenly needed help, that help is something that's immediately accessible. And unfortunately, that's not the case. Part of that certainly isn't the treatment provider's fault. It's the fact that this epidemic has grown so rapidly. It's impossible for them to keep up with, triple and quadruple the amount of people coming for help. So one of our goals is to increase access to help. One of the things that we're doing is working with area police agencies to enact the Gloucester model, where people can turn their paraphernalia and drugs into a police station and then ask for help, and then we have volunteers that assist them to get placed in treatment.
How much progress are you making in that effort and some of the others that you're undertaking?
I think that we've done a lot, actually, because we just started our organization in February. So we've made great strides. Broome County Sheriff's Department has signed on to the Gloucester Initiative. Their program is not running yet, but we just met the other day and we're hoping to have their program running in January. Cooperstown has already started their program the week of Thanksgiving, so we have them up and running. Oxford Police Department will probably be starting within a month. Johnson City Department we're meeting with Friday, and then Oneonta, Sydney. So we feel like we've made a lot of progress in the area.
Well, some steps, large and small, can hopefully make a big difference. Alexis, thank you for joining us.
Thank you so much.
Up next, to look at how Binghamton's drug court is taking a new approach in handling addicts. The rise in the heroin epidemic has also led to a rise in the crime rate. How are local officers handling the increased workload? We rode along with one patrol that tracked down a bust.
937, good. Deputy Cower began his shift on a Wednesday evening around 7:30. Cower has been patrolling the streets of Broome County for 7 years. In that time, he's watched the heroin epidemic in our community spiral out of control.
When I started, it was crack cocaine. And then for a while it was meth, and now it's heroin.
With heavy heroin use comes constant overdoses. Cower says those calls have become a burden on law enforcement.
We're typically the first responders there on overdoses because we're already in our cars and already near the calls, as opposed to like an ambulance or a fire crew has to load up. We're the first ones there, and we're the ones giving that Narcan. We're saving the person, bringing them back. They go to the hospital for a while, get checked out, and then they get released.
Police can't arrest anyone at an overdose call, nor can they force them into treatment. All they can do is give them these cards with hotline numbers on it. So while they're saving lives with Narcan, some officers wonder how much good they're really doing in the long run.
You talk to 8 other people that same night that all do heroin, but you couldn't arrest them or couldn't get them some kind of help. I mean, what are you really doing?
Just an hour into Cower's shift, he learns the Special Investigations Unit Task Force have a bust on their hands. We head to the Johnson City Police Department, where Cower negotiates with investigators. The undercover cops agree to allow our Fox 40 crew in for an exclusive look at the inventory. They speak candidly to our cameras on the condition that we conceal their identities by showing only their hands and feet.
What you see here is 3 bundles. So this is 1, 2, 3, and that's 30 bags total.
The investigators run tests on what they believe to be heroin, which confirm what they already knew.
If it is heroin, is we put a little bit of the subject sample in there, break an ampule in there, and it'll start off, it'll turn orange, and then within 12 seconds it'll turn to purple. It turned orange, and then it goes towards that purple color right there, and that's a positive test for heroin.
The amount they seized is just a sliver of what's circulating through the area.
It used to be more expensive to buy, and now it's coming down, which just shows you that there's that much more in the area that these people don't have to pay, $200 a bundle.
Police are frantically working to take heroin off the streets, and they already have their hands full with drug-related crime.
It's out of control. They steal from their parents and their grandparents, their brothers, their sisters, husbands, wives, whoever they have to steal from. If they don't have the means to pay for it, they find it.
Many local departments are understaffed as it is. As the impact of heroin intensifies, resources stretch thinner and thinner.
More overdoses and more people out doing heroin, stealing stuff, doing robberies. You're tying up all those resources and guys that you wouldn't have, say, 7 years ago. We were out actually trying to be more proactive.
Cower says he feels law enforcement is trying to fight this beast with their hands tied. Police are calling for backup. Some want to see legislation put in place to help them combat this crisis.
I think there has to be some other repercussions in some other way. So either you have to let us arrest them, or if we do save their life on an overdose, make them go to certain classes.
And tougher penalties for dealers.
You get the dealers off the streets, and if people can't get their hands on the stuff, or if it's harder to get somehow, then they're going to either resort to something else or end up quitting and becoming a better person for it.
A plea from police to help them take this poison out of our community. In Johnson City, Carrie Longabuco, Fox 40 HD News.
From the streets to the courts, Carrie Longabuco sits down with the judge who oversees Binghamton's drug court.
Thanks, Jason. I'm here with Judge Plala, who's going to give us a look at exactly what drug court is and where the idea of drug court came from.
Well, drug court in Broome County started in 2002. But before that, it started in the city of Rochester for New York State. The original one nationwide was in Miami, but the one in New York State was Rochester. And then in 2002, the leaders of our community got together, both in the criminal justice system and in our community, and decided that it was time for a drug court in Broome County. And we got together with the different partners throughout the community, decided how we wanted to handle such a program, and went forward with it. And so it's been up and operating since 2002, and each year it gets more successful. I think when we first started, there were only about 12 participants, and now I have over 60, and it's growing even more each and every year.
And it takes a specific type of participant, right, for drug court?
Yes, the person cannot have any violence in their criminal history. They have to be a non-violent offender. They have to have a drug addiction, and they have to be willing to take part in a recovery program.
Now, Judge, what interests me and fascinates me about drug court is that it's kind of like a second chance for, you know, these people who are struggling with addiction rather than going straight to the legal process. Talk to me about the logic behind that.
It is a second chance because originally, or not originally, but oftentimes with drug addiction, there's a vicious cycle that's associated with drug addiction, and that is that the person gets addicted to a drug, they start using, they need to then feed that addiction, and they need to come up with money, so they commit crimes, property crimes, crimes of stealing against their families, and so forth. And so they then get arrested, they go to jail, they get out of jail, and the vicious cycle just starts over again.
Judge Plella, thank you so much for being here.
You're welcome.
We appreciate it.
Thank you.
Jason, back to you.
Thank you, Carrie. We'll have more on heroin, a community in crisis, after this. That's our look at heroin, a community in crisis. We will continue to bring you the latest on our area's efforts to overcome the heroin epidemic. Thank you for joining us.